Here is your stem.
I'm ready, Mom.
Okay, both are ready?
Yes, ma'am.
Okay, so if you've read and understood, considering it communication skills station, please begin.
Hello. Good evening.
Hello.
I'm Dr. Lamia, one of the surgical doctor. Thank you for coming. I believe
This is my
that you
child,
are
doctor.
I'm really sorry. I sincerely apologize for not being able to speak to you sooner. Given the urgency of situation, we have to take your child to operation room right away. We had to make this quick decision to prioritize his well-being. I assure you, every action taken was in the best interest of your child. I'm here to
Okay.
answer all the questions you might have
Oh, operation room?
and provide
What
you.
happened, doctor? What happened? Is he okay?
I can see how worried and overwhelmed you are, and that is completely understandable. Um, could you please have a seat? It might help you relax a bit. I promise I will
No,
explain to you everything.
okay, doctor, I will see. But tell me, why you have to take him to the operation?
Thank you. Um, okay, I can see how this must be for you. Your child has been brought in by his father after he fell in the garden. When they arrived, we found that your child is unconscious, and we found bruises on his sides. We performed an initial scan, which was an ultrasound similar to the one that used in the pregnant woman. It showed a possibility of ruptured spleen. Let me help you to understand what I mean by ruptured spleen. Let me draw for you a diagram. A spleen is a small organ that found in the left upper side of your tummy. This is your chest, and this is the tummy. And just beneath the ribs, we can find the spleen. You can think of it. You can think of it as a part of body defense system. It helps your body to filter blood and get rid of all blood cells and also fight infection. A ruptured spleen can cause internal bleeding, so we act to address this to prevent further complication. Our team stabilized your child and sent him to operation room. Now the surgery is underway, and we will do everything possible to ensure positive outcome.
That seems very serious, doctor. Is he going to die?
Unfortunately, ruptured spleen is a serious condition, and this is precisely why we proceed with surgery without delay. We had to act swiftly to ensure he has the best possible chance of recovery. I want you to know that he is now in the hands of highly skilled and experienced medical team who are deeply committed to his well-being. However, ruptured spleen remains a serious condition and potentially could impact his life.
Who brought the child to the hospital, doctor?
Could you please repeat your question again?
Who brought the child to the hospital?
It's his father.
Oh, that's man. This is not the first time when the child with him he go to the hospital, and that man is not his father.
Thank you for sharing such a valuable information. I'm really sorry to hear that your child has been hurt before. I can see this is a lot of this is a great amount of pressure you are handling with. Usually we keep the personal information confidential, but in such a cases we have to take extra precaution to ensure your child in a safe hands. Well, to do that, we have to inform child protection services and child protection consultant. We do such we do this standardized and we do this standard and necessary procedure to provide possible support and protection for your child.
Oh, doctor, I am worried about what you are doing.
It's normal to feel worried when your child facing surgery. I assure you, he is in the hand of highly experienced and specialized team.
Okay, is a spleen important, doctor? You told about a lot of function. So,
Yes.
what are you going to do exactly in that operation?
We will going to make a big cut in his tummy to look inside and look for the problem. We will try to keep your child's spleen as healthy as possible. If needed, we may fix it or take out just part of it. However, if that doesn't work, we have to remove the whole spleen. I understand it's a lot to take in.
So, when you remove it, you said that if spleen is important, what are you going to do?
Yes, as a spleen play a vital role in immune system after the surgery. If your child have to have his spleen removed, we have to give him vaccination for lifelong, and he will also require to take antibiotic until around age 16.
Okay, doctor, I want to see my child now, please.
Um,
Can you let me see him?
I understand how anxious you are, and that's completely normal. I'm going to go and check by myself and come back to tell you about how he's doing. I want you to know that he is receiving the best care, and I promise you, you will be the first one to see him at the moment he get out of operation room and settle in the recovery room.
Okay, can you go by yourself and check him and tell me?
Yes, as soon as we finish our conversation.
Okay. So, for how long he is going to take the antibiotic you told me about?
He is going to take antibiotic until around 16.
Okay. So we'll go home immediately.
Hello?
Can we go home immediately after the
Hello?
operation? Yes, I am here.
I can't hear you. Could you please repeat your question again? I'm so sorry.
Okay. Are we going to go home immediately after the operation?
How long
Hello?
are we going to stay? How long are you going to keep my child at hospital?
Okay. I understand it's a worrying time for you. Our first priority is your child medical care. We have to ensure he makes a good recovery. We can discharge him until we have undertaken a full examination and make sure that his GB is aware um, uh, that there may be concern.
Okay, thank you. How would you close your consultation?
Do you have any question? Do you have any question? And
No,
I'll
Dr. Thank you.
summarize. Let me summarize for you what we are told about. Your child is brought here after he fell in the garden and injured himself. We do initial scan, which was an ultrasound. There is a possibility of rupture spleen. Now he is he is in the he is into the surgery, and yes, that is all we talk about. I'm going to check and came back to tell you.
Okay, thank you.
Thank you.